Hello, this is Dr. Gay from First Look MRI, and this is a 45-year-old female with complaints of low back pain. She had no recent injury. She's not been doing any more stressful activities than usual. She has jogged a little bit recently, but really not very much. And this is her lumbar spine. So her low back is hurting, and she wanted to make sure she didn't have a disc herniation. She said it's worse by the end of the day, but there's no shooting pain down the right or left leg. And her lumbar spine looked really great. Her vertebral bodies here, these squares look wonderful. The discs in between look great. If we roll off to the sides, we see these openings. The foramina look wide open. So her back looks fantastic. But we did notice that she had something down below the low back. This is in the sacrum on the left side, and on the right side she had these areas of darkness in her bone. And this is what we call marrow edema. And so marrow edema, when we see it down in the sacrum, it may be related to abnormal stress. We call it stress fractures. So when people run, if they haven't run in a long time or have some sports-related activity or exercise-related activity, they can have too much stress for the bone to handle, and it'll become bright like this. We did some additional views once we saw that of the sacrum, just threw them in, and here you can see her left sacrum. Here's the bottom, top. Here's the top on the right side, down the bottom. So there's some really prominent marrow edema right adjacent to the SI joint. This is called the SI joint or sacroiliac joint. There's the ilium. Now this is the left side. The marrow edema is even worse. So prominent marrow edema. This is the left SI joint. This is the left ilium. It also has edema in it. So this looks like a really prominent sacral stress fracture from abnormal activity, even though she has not done that much. Maybe the jogging she did recently was just too much for her to handle, or it may be related to what we call an insufficiency fracture. And so that's if you have a normal amount of stress and the bone is just too weak. So people with osteoporosis or other metabolic conditions can have weak bone, and then they just do some minor activity and they can develop these stress fractures. So she's going to get with her doctor and get her bone mineral density tested, her vitamin D levels, and see what's going on. But there's no offset. If the patient doesn't stop doing their activity or immobilize, they can have fractures that become displaced and the pelvis can shift. But it looks like we're catching it early enough. So I just talked to her, and she's very surprised that she has this because she doesn't really feel that bad. But the findings here do look pretty significant by MRI. So this is bilateral sacral insufficiency fractures or possibly stress fractures, and also this edema in her ilium as well, probably related to the same process. And her lumbar spine, which she was worried about, looks normal. And here's one more look at that. Nice lumbar vertebral bodies, nice intervertebral discs, nice spinal canal. And that's it. Thank you so much.